It is a very challenging and hard position to be in. We're making it do right now, and we have more capacity to expand, but it is limited capacity to expand. Our teams are stretched. We are managing it, but we can't sustain this trajectory for many weeks.
Well, you heard the man. In Texas, local officials in several cities, Austin, San Antonio, Houston, are concerned that increasing hospitalizations could overwhelm intensive care capacities, some of them in short order. Today, the state logged new record single-day highs, as we mentioned, in 3 separate categories: new coronavirus cases, deaths, and hospitalizations. Texas added over 10,000 new cases. That beats Saturday's record of over 8,200. Today, their total was fully 1/5 of the new cases in our country. Coronavirus hospitalizations more than doubled in the last 2 weeks. For more, we're happy to welcome to the broadcast Roberta Schwartz. She's the Executive Vice President and Chief Innovative Officer at Houston Methodist, a healthcare group with multiple hospitals across the largest city in Texas. Also serves as the COVID-19 Incident Commander. Roberta, thank you very much for coming on. I'm afraid I have a flurry of questions for you. How bad is it there tonight? What kinds of patients are in your ICUs? And if I needed an ICU bed tonight in Houston, could I get one?
So in all of Houston, the number of cases are growing quite substantially. Every other day or so, we have a little bit of a flattening, but then the cases start going up again. Right now in our hospitals, we have over 750 patients in our hospitals, and that number, unfortunately, keeps growing. We have many more medical type of patients than we have ICU type of patients, but both patient groups are growing at pretty rapid rates at this point. When I go into the hospital each day, we're turning yet another unit or yet another set of beds into COVID patient beds. I will say that for whatever condition you have, if you come to the hospital, you will be taken care of. And it may be that you have to wait a period of time to get into a permanent bed, but today we are able to take care of all of the patients that are coming to the emergency room and to the hospital. And we are very concerned that people don't wait and not come to the hospital if they need the care, because we are taking care of them.
Well, may that remain the case. As you're talking, and you're the latest person to talk about wards being converted on the fly every day in real time as patient numbers rise, does it strike you you're living a little bit of New York mid-April?
There's no doubt that the stories that we heard from New York are in my mind every day when I walk down a hall and we take a unit from kind of an open unit where the staff would just be masked and would be treating patients like normal to what I call a yellow unit. And a yellow unit is when the hooks go on the door and all of the PPE come out. For us, our gowns are yellow color. And because they're yellow color, I call them yellow unit. One of the issues that we have, and when you think of New York, is at some point the demand outstripped the number of beds and the number of staff, and the staff were certainly stretched to take care of the patients. Today, I don't believe we're in that scenario, but if we don't get the behaviors correct in this state, and that includes the masking, the social distancing, and the hand hygiene, and really being absolutely diligent on each one of those issues, I do fear that we will end up in the position that New York was in.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.